So if you focus specifically on the health effects which have been attributed to diesel exhaust, they include impacts on heart disease, increased risk of stroke, ischemic heart disease, respiratory effects, worsening of asthma symptoms, worsening of symptoms of COPD. Actually, there's evidence that it contributes to the development of those diseases. So it's not just aggravating a pre-existing disease, it's potentially making you more likely to develop those diseases as you age. There's increasing evidence of associations with dementia risk. And that might seem surprising, but perhaps it shouldn't be, because air pollution is linked with stroke, and stroke risk is associated with dementia. So maybe that was a health association we should have seen coming in the past. And underpinning all of those things, so what you're doing in these studies is saying, okay, we've estimated people's diesel exposure, and we've shown that it's related to those diseases. You know, I and my collaborators have also put people in boxes and exposed them to diesel exhaust. So I can tell you that when an individual breathes diesel exhaust at concentrations which are not a million miles from the concentrations we observed in some of the cabs of the vehicles in the most polluted areas of London in this study, we can demonstrate that there is inflammation, there is injury to the airways, there is actual adverse physiology you can see in real time in experimental studies at concentrations which are within the range of the concentrations we've seen professional drivers exposed to in this current study.
So what we found out was that professional drivers were exposed to 2 times higher levels of black carbon when they were driving compared to when they were not driving, and this was 4 times higher compared to what they were exposed to at home. A couple of the sectors that we measured, taxi drivers, couriers and waste removal drivers were the highest exposed sectors. In terms of what drivers can do to reduce their exposure, we found that closing windows was the most effective intervention method to reduce exposure to diesel emissions. We measured taxi drivers in central London. They're often very congested areas. They drop off and pick up passengers on basically the most congested intersections. So they were more likely highly exposed due to travelling in these congested places compared to other occupations which might have a more prescribed route of travel.